Awesome. Welcome, everyone. Thank you so much for joining us for our AYA Talks event, Navigating Cancer Costs, Tool, Tips, and Resources for AYA Patients. This series is brought to you by the Inova Adolescent and Young Adult Program in partnership with Inova Peterson Life with Cancer. We hope to periodically provide guidance and education on real life and real talk for AYA patients with cancer. Before we get started, just some housekeeping things. We will have about an hour of content today, maybe a little over. If you have any questions, please feel free to send them via chat. We will not have time to address questions during the presentation, but at the very end, we will take some time to have a little Q&A. Please try to keep any questions or comments general and refrain from sharing specific personal details so that we can be mindful of your privacy. This webinar will be recorded, and it also will be available on demand on the Peterson Life with Cancer YouTube page. There will be some great resources that will be highlighted throughout the presentation. I will be sending out the slides to the emails that you use to register for this event. So don't worry, because I know we will be covering a lot of information, but you will have access to the slides and the resources later, in addition to the recording. If you can go, thank you.
There you go.
Thanks so much. So now that we took care of some of the housekeeping things, I can go ahead and introduce myself and our two incredible speakers. So my name is Vanessa Wagner. I am an education support navigator with the Ask Childhood Cancer Foundation, and I primarily work in the PSV Center for Cancer and Blood Disorders at the Inova SHAR. My role involves supporting patients and families in their education journey. You might have joined in on our last AYA Talks, which was called Charting Your Course, where I talked a little bit about different post-secondary school options and available scholarships. If you weren't able to join that talk, please make sure you watch the video. Again, it's on the Peterson Life with Cancer YouTube page. One of our keynote speakers for this session is Jemma Stratton. Jemma is a pediatric oncology behavioral health specialist with the Inova Peterson Life with Cancer program. She currently works at the PSV clinic as well. Gemma's role is to provide therapeutic support to our patients and families. She has been involved in the Inova cancer community for about 5 years and is here just to share all of her great resources and knowledge with us. So we look forward to that. Thank you, Jemma. Our second keynote speaker is Jordan Motley. Jordan is a pediatric oncology social work case manager. She also currently works at the PSV clinic. Jordan's role is to provide financial support to patients and their families by connecting them to community resources and organization. She also provides administrative assistance and helps patients with financial applications, submitting and paying bills, and preparing any necessary letters that families might need. We are thrilled to be joined by two incredibly knowledgeable speakers. And here's the agenda of some topics that they are going to cover for us today. So they will talk a little bit about financial toxicity for AYA patients, common insurance terms that are good to know, government programs and benefits, how to leverage your care team. We'll have some additional resources because you know we love to give out resources. And then that's when we'll close out with a Q&A.
Thank you so much, Vanessa, for that introduction. So I'm going to start this presentation with an overview about why we believe informing AYA patients and families about strategies for navigating cost is so important. I don't think it's just important for us to provide the resources, but I think it's important to normalize why this financial piece can be so hard. And some of it's very obvious. There's really high medical costs, but it's also important that there's some specific things about being a part of the AYA population that makes it extra difficult. There's a term that we sometimes use specifically in healthcare for individuals experiencing financial strain during a medical crisis or treatment, and that's called financial toxicity. So I'm going to just spend a little bit of time talking about what that means. Financial toxicity includes the ways in which the cost of medical care can affect a patient's quality of life. So we are talking about all the different ways that being involved in the healthcare system can cause increased financial costs that just ends up trickling down into many aspects of your life. So we talk a lot about healthcare in healthcare settings about patients. There are potential risks to side effects of medications and treatment. You know, we spend a lot of time when you're consenting to a medication knowing exactly what's going to happen, or what could happen. But it is important to talk about those quote unquote side effects of the financial burden too. So that way our patients can be informed and prepared for what may happen. AYA patients, and you're going to hear us say AYA a lot, are defined as adolescents and young adults between the ages of 15 and 39. And so AYA patients have some very unique factors related to medical costs. Um, this is a large part due to being in this age range. It's a time of personal development where a lot of different things are happening. We have teenagers who are getting more responsibility, but are still under the care of their parent and guardian. We have individuals who are approaching that post-high school time period where they may be working or going to college. Young adults in this range are also just starting their careers and maybe really early on in that process. So that sometimes limits the amount of benefits and flexibility that they might have in the workplace. In this early stage of adulthood, there may be more limited financial assets that patients have accumulated as less time has occurred for in their careers to build up those things. So things like, diversity in their financial income, savings accounts, things like that are not typically as built up when you're a young adult. Those things are still being worked on, and you don't necessarily have a large savings to fall back on. And additionally, this is just a time where there's a lot of life changes. We're seeing our patients starting their own families, early parenthood, maybe having dependents of their own, which might make a lot of these things more challenging. And so for young adults with cancer, we see that nearly 50% experience financial toxicity. You know, nearly 1 in 2 young adult cancer patients are endorsing that they're experiencing this stress. And so I really want to normalize that this is something that's happening frequently to our patients. It is common for patients to need to do things to make their financial situation with their cancer treatment work, like borrow money from family or friends, or even from outside loans. Um, we see that how that may affect medical decisions because some research has found that this stress can sometimes make patients hesitant to fill their supportive medications prescriptions due to cost. And we also see that there's a little bit of a trickle down. There's a lot of long-term effects that can come from this experience of going through cancer as a young adult, and kind of an ongoing effect on financial well-being. You know, goals are being set back. That financial wellness is being set back. You might not be able to build up those savings accounts. And we, in statistic I have on the screen, some research has shown that 44% of young adult patients experience a credit score decrease. So you think about what we use our credit scores for, and shows how important it is for there to be some financial support for this population. I also wanted to spend some time talking about our younger range of the AYA population, so kind of more of that pediatric cancer diagnosis area. So research finds that about 1 in 3 pediatric cancer families are unable to meet their basic needs. And so this financial impact is happening at this age range as well. A majority of parents experience some form of work disruption due to having to care for their child, whether that be taking time off or even losing their job or their employment. And understandably, we're seeing that this results in a large loss of income during this time period. So 72% of families reported losing more than 50% of their income since the time of their child's diagnosis. And so this affects, again, the long-term financial well-being of these families. And so I know some of that feels overwhelming to hear. And it's really important to me if there is anything I want you to take away from this presentation is that I want to normalize that this is a real stressor for many patients and families. And if you have felt impacted by these factors, you are not alone. One of the most important protective factors to help mitigate some of these concerns is education and finding out who are the people on my team that can help? And what are the resources I can use to make this part easier to navigate? And that's really what we're doing today. We're starting that conversation, giving you some tools. And by no means will this presentation cover everything, but I'm really hoping that we'll at least be able to provide some tools for you to walk away, whether you're a patient or a loved one, to really improve your understanding of how you can best navigate these financial stressors and hopefully be prepared to mitigate some of these more out-of-pocket expenses. So one of the first hurdles with navigating any financial costs when you have a cancer diagnosis is insurance. As a social worker, we get so many questions about insurance plans and insurance terms because it's not something that you always get a crash course in of what all these terms and things mean. And so while this might be common knowledge to others, it's not for some patients. And so I really want to make sure I take some time to walk through the common terms, what they mean, so you can feel prepared when you're navigating your insurance claims and your out-of-pocket and in-network expenses and all those things that might feel really confusing and overwhelming, especially when you're going through treatment. So I'm first going to talk about premiums, deductibles, and co-pays. So your premium is the amount you are paying monthly for your coverage. This may be taken directly out of your paycheck if your insurance is through your employer, or you may pay it as a separate bill. So think of it as a membership fee. So it's a certain amount that you're paying every month in order to have your insurance. Your deductible is going to be the total amount of money you are expected to pay for medical services before your insurance starts sharing the cost. There are some services that your insurance plan may cover without requiring you to meet that deductible. Sometimes, a lot of times, like primary care, they might cover except for a copay, things like that. But there are going to be services that they won't necessarily start sharing that cost until you've met that deductible. And so for some people, for instance, you could have $1,000 deductible means you need to pay $1,000 before insurance is really going to start sharing that cost for many different services. So it's something to think about, especially as open enrollment is just around the corner for many, and what you'll have an opportunity to make adjustments to your plan. So something to look at. Well, what kind of deductible do you have? Does that make sense for where you are currently in your health journey? And then you have the copayment or the copay. So this is a fixed amount that you will pay for a certain service. And so sometimes the copay will be in effect even though you haven't met your deductible, but the insurance might still cover some of that cost because it's an accepted service. So again, like a primary care is a really common example for that. And so that could look like when you go to your primary care doctor, insurance covers everything, but you have to pay $20. Or they might cover certain medications, but you have to pay $10. And so that's that copay amount. And usually that's able to be listed on your insurance website and information you can get ahead of time. So already I feel like this is a lot of information, right? It's kind of like a puzzle pieces. We're trying to figure out how to make medical care affordable, and sometimes it gets really confusing. I really recommend that when you submit a claim to your insurance, you're going to receive something called an explanation of benefits, or an EOB for short. I really recommend checking these when you get them because it gives you a breakdown about what your insurance is covering and what has been considered out of pocket. So you can better track, okay, what part of, this treatment, a portion of this went to my out of pocket spending, which we'll cover in a second. A portion of this went to my deductible. But it also gives you information if something doesn't look right, appeal, appeal, appeal. Like it's always okay to send an appeal. You never know if that's going to end up in a better outcome. And being aware and checking these things can really save you some money sometimes. So another term you might hear is coinsurance. So coinsurance is the way your medical bills are paid after you've met your deductible. So you might be saying, well, I met my deductible. Why aren't they paying 100%? Unfortunately, a lot of plans have some type of coinsurance that you still might need to pay. And so for some services, your policy might indicate that you pay 20% of the cost while your insurance covers the following 80%. Sometimes you might hear, and we'll talk about it a little bit in another slide, but secondary insurance is something that some individuals have access to, especially if you're a pediatric patient or a minor, or sometimes if you've been enrolled in some type of hospital-based financial plan, you can get secondary assistance or secondary Medicaid. And what this means is that you have almost another layer of insurance. So when your first insurance doesn't pay something, the second insurance can kick in. Fortunately, that's not always something that everyone's eligible for, but you might hear something about that. And so, of course, there's going to be expenses that you're paying out of pocket. And so usually an insurance plan will have something called an out-of-pocket maximum. So even after meeting the deductible, you might be paying, that 20%, or you're paying those copays, or you're paying what you had to before you met your deductible. This all is going to contribute to your out-of-pocket maximum, which is the total amount you need to pay until your insurance typically then kicks in at 100%. Again, some of this will be dependent on your policy, but typically once you hit that out-of-pocket maximum, that's when your insurance will kick in fully. Something I always want to remind patients and families is that deductibles and out-of-pocket maximums and your all of these factors reset at the beginning of the year. So it's really good to kind of think strategically about that. If you have a scan scheduled for that could be scheduled anywhere between maybe like early January, see is it possible for them to move it to mid or late December. It's not always possible, but it's always something to kind of start thinking about. Can I try to keep some expensive services before the end of the year? Because you're going to have to meet that deductible again once the new year starts. Of course, as I know many people experience with cancer treatment, because of its cost, that deductible is met pretty quickly, but it's just something to think about. And so now we're going to talk about the network. You probably often hear about whether a provider or a service is considered in network or out of network. So certain providers, hospitals, healthcare systems are kind of build a network for certain insurance companies. So this means that when something is in network, they have a pre-established relationship with the health insurance plan where they've negotiated cheaper rates. So they have a partnership, a contract, and that's going to be when they're considered an in-network provider, as this will result in lower costs out of pocket, but also lower costs for your insurance company. The larger the institution, the more likely they accept a broader range of insurances. Smaller clinics and smaller places might have more limited insurance that they accept. And that means that they just haven't made those partnerships. Out of network would be then all of those providers that there isn't that pre-established relationship. And so your plan might either not cover that service or you will have to pay more out of pocket. Sometimes, and I'm sure lots of people have experienced this, you submit a claim for a certain specialist visit or something like that, and your insurance might come back and say, well, is there someone in network that can provide the same service? And they'll try to recommend going to an in-network provider instead of an out of network provider. However, there are cases where you may need a specific specialist or service that maybe there isn't an in-network provider available that performs that service. Um, Communicating with that specialist provider and having them assist you with providing documentation supporting the medical necessity can sometimes get your insurance plan to cover those services if there's not an alternative that's already in network. So that's something to think if there's a specialist visit or something that you're hoping to get, but you can't find an in-network provider and are nervous about that cost. There are ways to make an appeal to say, hey, there isn't anyone in network. And that's something that through pre-authorizations and kind of communicating with that clinic, your primary clinic, will be able to help you with. So lastly, I wanted to quickly go over the differences between types of insurance plans, just to make sure that everyone understands kind of where are they getting their insurance and what does that mean. So first we have Medicaid, which is a joint federal and state program that provides health coverage to eligible individuals. That eligibility is typically based on income and household size, with certain allowances if an individual is pregnant, has a disability, or a child or an older adult. Available Medicaid plans vary by state, but it's really important to understand that while each state has their Medicaid plan, there's different providers for Medicaid. So in Virginia, Medicaid is referred to as Cardinal Care. Medicaid sometimes has different names depending on what state you're in. For example, in California, it's called Medi-Cal. But in Virginia, where we are, it's called Cardinal Care. And within that Cardinal Care plan, there's different providers that offer Medicaid services and different insurance providers. For Virginia, one of the most common ones is called Anthem Health Keepers. There's other ones that are offered, but the reason why I make sure that patients know about that is sometimes when you're signing up for Medicaid, you sign up, but you might not check, okay, what plan exactly am I signing up for? And is that an accepted Medicaid plan at my institution or my clinic? Again, for larger institutions, this is not always an issue, but it's something to think about. And as we are approaching open enrollment, kind of thinking if you are planning on switching exactly who your provider is, and this is true for other insurance plans as well, that you're checking in with your clinic and making sure that you'll be able to obtain the same amount of coverage. Otherwise, you may receive your health insurance through your employer or through the marketplace. So employer provided insurance will be based on whatever insurance policy your specific employer partners with. So while you might have some choice, as there might be some variations of that plan, they might offer Aetna, and they might offer different versions of that plan with different deductibles and different out-of-pocket maximums and things like that. Um, you can select from. You still have to choose within an Aetna plan, for an example. Um, and typically you're making that selection when you're hired, or during open enrollment, which typically happens in the fall, or if there's another event in your life. So things like when you get married, when you have a child, things like that, you usually get an opportunity to make adjustments to your plan. Unfortunately, being diagnosed with cancer is not typically a criteria to be able to enroll outside of that period. And then if you do not have insurance through your employer or would like to have a different plan that's being offered to you, you can purchase a policy directly from the marketplace at healthcare.gov. And so that's almost like shopping around, picking a plan based off of your needs and what's affordable for you. Again, like I mentioned really briefly, sometimes people can have secondary insurances. So an example of that is secondary Medicaid. This is something that can be available based on income and things like that. And so this would be then secondary insurance that's used in combination with an insurance that you have access to. Similarly, financial assistance programs, which Jordan will be getting into in hospitals, sometimes they can act as almost like a secondary insurance and cover things that your insurance plan is not if you qualify. All right, well, take it from here, Jordan.
Thanks, Gemma. My name is Jordan, and I'm going to talk to you all about the benefits and government programs that you or a loved one may qualify for as an AYA cancer patient. It is federally required for certain employers to provide what is called the Family and Medical Leave Act, or FMLA. This is available to you if you have worked for your employer for at least 12 months or have accumulated at least 1,250 hours during that 12-month period and have an employer with 50 or more employees. FMLA is important because it protects your position if you have to take time off for an extended period of time. Your employer is not allowed to eliminate your position as long as you complete the necessary FMLA paperwork. You can use your FMLA as a continuous leave, meaning you can take time off in one long block, or you can use your FMLA for intermittent leave, meaning you can take time off in smaller blocks, such as for specific procedures, such as appointments or days when you're just not feeling well. FMLA is also available for caregivers too. Remember that FMLA, while protected for up to 12 weeks, is unpaid. Because of this, it isn't always feasible. Isn't always a feasible option for every patient or caregiver. So how do you apply from FMLA? First, you'll want to verify your eligibility and make sure that you meet all of the requirements I just referenced in the last slide. You would then want to contact your employer or an HR or your HR department. You do not need to specify more details than you're comfortable with. All you need to share is that you're interested in applying for FMLA due to eligible criteria. Most workplaces either handle these requests directly within their HR or use a third-party agency. You'll then need to complete the necessary paperwork. While specific diagnosis does not need to be disclosed, rationale for why you would be unable to attend your typical work hours does need to be provided. This is going to be done by your medical provider. Communicate with your oncology clinic directly. They will need to know if you're planning on taking continuous or intermittent leave. They will be able to complete the paperwork with anticipated time periods where you'll be unable to complete your designated work hours. Then you will need to turn in your paperwork and ensure it is approved. Sometimes minor adjustments may need to be made. Some employers are very particular about what needs to be included in your FMLA paperwork. Afterwards, follow your employer's guidelines. Each employer will have their own process for how you are to notify them when you're taking leave, when you're nearing your 12-week limit. Next, you may be eligible for short-term disability. This is different from FMLA. Short-term disability is not required at a federal level, meaning its availability will depend on whether it is a benefit provided either in your state or by your individual employer. It is not required in the state of Virginia. Short-term disability requires similar medical documentation and it is paid. However, depending on your employer's specific benefit, it is usually 40 to 70% of your wages. Some policies require you to use up all or a portion of your PTO before your short-term disability kicks in. You can expect this to provide coverage for about 3 to 6 months if you're eligible. Short-term disability is commonly confused with Social Security Disability Insurance, or SSDI. SSDI is available to you if you cannot work, take on a new job, and your disability is expected to last at least 1 or more years. Additionally, you must have paid into your Social Security for a certain amount of time. This means you have worked a certain amount of hours. This amount of time is dependent on your age. For under 24, you typically need 1.5 years of work credits. For ages 24 to 30, you typically need 3.5 years of work credits. Minors under 18 with a disability can qualify too, following most of the same requirements and will be assessed based on the income of the parents. Many cancer diagnoses are eligible. The Triage Center, which is an organization we will talk about later, has a great quick guide to learn more about navigating SSDI, specifically as a cancer patient or a caregiver. Lastly, if you're having a difficult time navigating your medical costs, let your team know. Depending on where you are treated, this team might look a bit different, but keep an eye out for any of these team members. You might meet a social worker, RN case manager, financial navigator, or an oncology nurse navigator. These team members are a great resource to identify specific resources available, not only at your clinic, but in your local community. There are various cancer organizations that provide financial assistance for basic needs, transportation, and other costs. Connect with your team and let them know what you need. Also, most hospital systems have some form of internal financial assistance programs that can provide coverage for those who are uninsured or have a significant financial barrier. If you're an Inova-treated patient or having a hard time with medical costs, you may qualify for financial assistance. Additionally, if you are uninsured, the financial assistance program can assist with providing coverage while treatment is being received. This financial assistance is otherwise known as charity care. The phone number and QR code shown on this slide is where you can learn more.
Thank you, Jordan, for all that information. I'm going to briefly introduce some useful resources that have just been very helpful to our clinic and just patients that we've worked with. So first, I want to talk about the Department of Social Services and just some of the various public assistant programs that they offer. There's 4 main things I want to cover. So the first assistance program provided by DSS is called SNAP. Sometimes it's also called food stamps or EBT. And this is just a supplemental nutrition assistance program. Another assistance program that they offer is called TANF, which is Temporary Assistance for Needy Families. This program provides cash assistance for families specifically with children. Then there's also CCSP, or Child Care Subsidy Program. This program assists with child care costs for children under the age of 13 or children with special needs under the age of 18, sorry. And lastly, there are programs to assist in emergencies with utilities, rent, and mortgage. Um, Again, you will have to go on to your local DSS website just to learn more about these programs and to apply, or you can scan that QR code there and it'll take you straight there. These are some additional resources that are free and that can be found online. I personally love these resources. So Jordan mentioned Triage Cancer. Triage Cancer is an organization that provides free education on legal and financial issues that may arise during or after cancer diagnosis. They have a lot of webinars and just a lot of resource guides and packets. And all sorts of things through Triage Cancer. They cover a lot of topics, so I definitely would check them out. Then we have Cancer and Careers, which is a great resource that educates people with cancer on how to thrive in their workplace, providing expert advice, interactive tools, and educational events. If you attended our last AYA talk, Charting Your Course, you got to hear a little bit about me talk more about this resource. They just really help with so much and so many different aspects. They can help with resume building, interviews, and all that great stuff. So I definitely think Cancer and Careers is worth checking out. They also provide financial assistance, so definitely check them out. I also want to bring up the fact that you can apply for accommodations through your workforce. I know I talked a little bit about accommodations on our last talk, but accommodations are not just for school. They can also be applied to careers, and Cancer and Careers has a great series on how to go about getting those accommodations. There are also resources that can help alleviate just some of the stress around going through treatment. A popular one is GoodRx, and this just helps you find the best out-of-pocket price for medication. They offer coupons and just different resources to help reduce the cost of your prescriptions, just making it overall more affordable. And as I'm sure you all know, keeping up with chores in general is just very difficult, especially as an AYA cancer patient. You're juggling with work, treatment, family life, and all that can be really hard. So Cleaning for a Reason is a pretty cool resource. They provide up to 2 free home cleanings for patients being treated for cancer. So again, if you just go on the website and apply, that is an easy way to just make life a little easier around the house. And then the next two that we have are Bright Spot Network and Stupid Cancer. So Bright Spot Network is another amazing resource that provides assistance for young parents with cancer. So they have financial assistance available. They have free books about cancer for kids, just to explain to kids in a child-friendly way what is cancer and what that looks like. Young adult and parenting specific support groups can be found through that network. And again, a lot of educational resources in general. Stupid Cancer, I also love. I talked a lot about that one too in our last talk. They just do a lot in the AYA space in general. It's just a great place to go check out additional resources. They have a great adulting resource guide that provides a lot of great information and resources for handling financial and practical matters. And a lot of these resources that I'm throwing at you, they do have a lot of support groups that they like to form. Stupid Cancer being one of them, they really try their best to make a community. So it's also just a great way to try to get involved and just to talk to other patients that are also in the AYA cancer group. And that leads me to my next segment, that peer support is just so important. And the Peterson Life with Cancer regularly offers support groups, social opportunities, and educational events that cater specifically to the AYA community. You can check out their offerings on that same calendar that you use to register for this event. So all their events and everything is on there. So again, it's just a cool resource that you should definitely check out. Most programs are open nationally unless otherwise noted, but no matter where treatment is being received, you can access these young adult groups. And I also have to put a shout out to our future AYA talks. This is our second one in the series, and we have two more coming up. So the next one is on October 16th, and we will be talking about AYA social connections through cancer. And on November 6th, we will be talking about addressing body and sexual health after a cancer diagnosis. Definitely join us if you can. We love having people here live with us, especially for that Q&A portion. We like all the feedback that you guys give us. So being live is great, but if you can't make it, that's okay. Please make sure you look at our YouTube page, the Peterson Life with Cancer page, just to find those videos in case you can't make it.
All right. Oh, thank you so much, Vanessa and Jordan, for going through those resources. I know we've finishing up a little bit earlier than planned, but I did want to just really emphasize that um, if you are an individual experiencing any kind of financial stress related to your cancer treatment, even in the survivorship portion, please let your team know. I know it can be really hard to ask for help and to share those concerns. There are so many other resources that I wish, it could be a whole webinar in itself to go through every single one. But know that there are a lot of cancer specific organizations in your local community as well as nationally that provide grants to help with costs like transportation, your household bills, covering medical debt. And by letting your team know, whether that be your social worker, your nurse navigator, or one of the financial navigators that you might have through your institution, um, they can start helping you figure out what those resources are and at least directing you to those things so you don't have to be navigating all of this on your own. And that's why also we wanted to put emphasis on different places you can go that have those communities, like Vanessa was saying. That peer support is invaluable when you're going through a really challenging time with your cancer diagnosis, not only for that emotional support, but for those practical things too, like hearing how did you make this work? How are you navigating having a 3-year-old and not working and not getting to see your spouse and all those things that are really unique to our AYA population. And so I just really encourage you to let your team know and really and use those resources. They're there for you. And while can be a really hard journey, your team is there to hopefully make it a little bit smoother. So now we'll take a pause and just offer some time for questions, comments, anything that's kind of coming to mind. You can put it in the chat or the Q&A section, but if there's any questions you're having about anything that was discussed, or kind of comments that are coming up for you, we'll take some time to take on those questions.
Also, again, just to go off of what Jemma said, a lot of these resources, I know we touched on them briefly, but they really just have so much to offer. So even just typing into Google stupid cancer and seeing all the things that they have, you can explore their website and you'll see that there's just ample amount of resources within that one resource. And the same with all of these that we presented on. So I definitely suggest if you find time, if you're ever bored, you're sitting in the waiting room, I really suggest looking at those and just perusing their website, just because they have so much to offer.
Absolutely. And so we did just get a question if an AYA patient is struggling with managing work responsibilities due to fatigue, neuro changes, kind of difference. I'm assuming they're meaning like differences with concentration, focus, all of those things. And their boss is putting pressure on them. How do they go about getting support or help? I think definitely a really great resource to go in that situation, like Vanessa was sharing, is Cancer and Careers. They have some toolkits about how to navigate accommodations. Obviously, this is a really hard situation, right? When you're getting pressure from your boss, maybe you're just returning to work or you're still working through treatment and you're trying your best to perform, but we can't always show up 100% in every avenue that we want to. One of the things I would recommend to patients in this situation, if they have an HR department or contact within their employer that they can reach out to discuss things confidentially. Sometimes it's really intimidating to talk to your boss directly about the things that you need, but know that you do have a right to reasonable accommodations in the workplace. So you do have rights as an employee, and it is okay for you to go about the process in order to get those rights applied to you, and to have access to the accommodations you need. So just like Vanessa was saying, about school-based accommodations, you can work with your HR, work with or whoever that might be at your employer, and see what are some accommodations that might work for you, and get those added to your employment plan. And that way, it has to be a part of your plan, and it's a little bit easier to advocate for yourself. I don't want to sugarcoat that this is a really hard thing to do. It's really hard to advocate for yourself in this way, and it can feel really vulnerable, um, especially when you want to be protective of your job. And then this is also a time where I would suggest kind of thinking about what Jordan talked about with that FMLA. Intermittent FMLA, if you have not used it and you're going through treatment, and it's available to you, use it. You can do intermittent. If it's very important to you to continue your work schedule, um, go ahead and at least fill out that paperwork. You might not even use it as much as you think, but having that ability to take that extra time off, take a half day, take what you need, adjust your work hours. A part of FMLAs, you can actually have them change what your work hours are too. Um, that way it's protected federally. So you cannot have your job eliminated because of those changes. And FMLA can be available to you even if you're in survivorship. If you are struggling significantly with side effects or late effects of your treatment, talk to your oncology office, and it may be appropriate for them to help fill out that paperwork and get you that FMLA. Thank you for that question. That's a great one.
Yes, and triage cancer also goes into more of the legality behind that. And it does talk about the Americans with Disability Act, which pretty much says I can't get into the specifics of it, because unfortunately I'm not a lawyer, but it does say that employers do have to provide some sort of accommodations. So definitely try to work with your HR, like Gemma said. And also, if you need help, I do suggest reaching out to your clinic social worker, just because sometimes some paperwork, documentation, diagnosis verification, all that stuff is needed. So it's good if you have that on hand, especially if you're going to go talk to HR about it.
Yes. Yeah. I've written many letters advocating for patients to work remotely, or to have different work hours. And so definitely explore those options. And I think that question also speaks a lot to kind of the common um, concerns that patients very reasonably has. As we talked about in the beginning about financial toxicity, there is concern about losing your job or not being able to work. And for some patients, stopping work is the best choice for them. But as we know, that's not always a feasible option or one that someone wants to do. And if that employment is important and needed, you want to work together to hopefully find a way for that to work. So we'll give a few more moments and minutes for any other questions that might come in. Again, we really thank you all for joining us today. We're happy to share this information.
And I also just can't emphasize enough how important that peer support is, because even with my job in education, I learned so much from the patients and how they go about things. That even questions about work and what other people are doing, it can be just super helpful to talk to someone else who's in the same position and kind of get feedback on what works for them, what didn't work for them. So again, just joining those peer support groups, I think is very helpful.
Okay. Well, if we have no more questions, then we'll let everyone go forth and enjoy your evening, depending on where you are in the country, and or morning if you're watching a recording of this later on. And so thank you so much for joining us. Again, my name is Jemma, and we were joined today by Vanessa, our education navigator, and Jordan, one of our social work case managers. Um, and please consider joining us for another AYA talk. We have some two great topics coming up. I'll have information about those events in the email that I send out probably later this week. And so I look forward to hopefully seeing some familiar faces and names that then. But if you have any questions, please reach out. Otherwise, have a great rest of your night.